Hello, everyone. I'm Molly Hadfield, the Media Relations Director for the City of Topeka. This is our weekly COVID-19 update press conference. We're going to start off with an update from Craig Barnes with the Shawnee County Health Department.
Perfect. Thank you, Molly. Good afternoon, everybody. We got a few quick updates for you today, and then we'll keep ourselves moving here. So I'm going to go ahead and start sharing my screen. Make sure I do this correctly here. All right, perfect. So what you see here, this is our COVID-19 dashboard. And so a couple of highlights that we wanted to point out today. So as you can see here, we have gotten up to 90 confirmed cases. So again, just to define that, those are Shawnee County residents who do have a laboratory confirmed positive case. So those are Shawnee County residents there. The other highlights we wanted to point out today is the active cases. These are the active cases that our nurses and case investigators are working on. So we've got 43 of those. Those are the confirmed cases after you subtract the recovered and the deaths. So we are working on those 43 cases there. The next piece here is the recovered. So as you can see, we've gotten up to 42 recoveries so far through this. And so the recoveries, there has been some questions about what that means. And so those are individuals who are 7 days past the onset date of symptoms, as well as 72 hours fever-free without the use of medications. So we're seeing that they're seeing also an overall improvement in symptoms. So hopefully that will help with the understanding there. And then the last big update here that we want to give is on these persons being monitored. So as you can see here, we've got 117 people being monitored. And so what that is, to add some clarification, those are, again, Shawnee County residents who are close contacts of laboratory confirmed cases. So the monitoring itself takes place for 14 days from the date of exposure to a confirmed case. And so again, clarification here, because I know there's been some questions about that through the week. These are cases specifically that the health department is monitoring. So these do not include cases of independent organizations if they've deemed their staff to be on a work exclusion or anything of that sort that are not being monitored by the SCHD. These are ones that our case investigators and our nurses themselves are monitoring. And again, these are Shawnee County residents. And so if they are with an organization and a retail organization here in the community, but they live outside of the Shawnee County area, but were being treated at a hospital, those numbers would be tracked by the county and where they have a place of residence. So hopefully that will help clear that up just a little bit. As you can see, we've also had 5 deaths throughout the entirety of this pandemic as well. So that's it for the updates there as of today. One of the things that we also wanted to make you all aware of is that we are working really closely with the Shawnee County GIS program, who does the updates for this dashboard. And we're going to try to make some future additions to this. And we're looking at doing that next week. So at some point next week, we're going to have a couple of additions to that. One of those is those definitions that I just kind of gave you just now. We're going to make those easily accessible here on the dashboard so that it's a one-stop shop. When you get in here, you don't have to try to figure out what is a negative case, what is an active case. We're going to try to put those definitions right here on the dashboard for the public to see there. Additionally, what we're going to do is now that we've reached the threshold for cases where it's less easily identifiable for a positive confirmed case, is we're going to start adding some demographic data. So what we're going to be looking at here is starting to add some data around gender, age, as well as race and ethnicity. So I know there has been some questions and the ask for that. So now that as long as we have enough of the cases to where it again is not easily identifiable or it can make it to where a positive case can be identified, we will be making that that data available to the public, hopefully starting about midweek next week. So. All right, so that is it for the dashboard today. The next update that I wanted to give you all today is we have made some additions and updates to the Shawnee County Health Department webpage. Our hopes here is to make it a little bit easier access to get to some of the important documents. First being that dashboard itself. As you can see here at the top, we have created a banner and with a couple of links, one being to that dashboard right there so that you can get to that very easily without trying to memorize this super long web address. So it's easily accessible here. And what we're hoping that'll do is, again, increase access to that. One of the great things that we have seen this week alone is an increased access to the dashboard. So this week we've seen over 19,000 clicks to the dashboard itself this week, and close to 50,000 clicks on the dashboard since its inception on March 23rd. So hopefully that'll make it a little bit easier to access for the public and for you all in the media. Also here on the Health Department homepage, you'll see this reporting banner. So this is again another easy access click that'll get you to that COVID-19 symptoms self-reporting form. So if individuals in the public think that they have symptoms for COVID-19, they can come to this link, fill out this form, and go through the whole process, and that will go to one of our nurses here on staff who will filter that and then make direct contact with individuals if they do meet the criteria for a testing, and then coordinate that as needed. Lastly here, this middle banner, prevention, this is a banner that you can click that will take you to the health department's COVID-19 response page. So we've made some additions here to add some more resources, some specific to healthcare providers, testing, as well as different populations. And then the other big thing is this banner again here at the top, trying to make some of the resources here in our community as accessible as possible so that the public doesn't have to kind of sift around and fish around to try to get some of the important numbers. So again, what you're going to see here at the top is that link that'll take you to that self-reporting form. We want to make that as easily accessible as possible to everybody. The next one here, this is the general hotline. So these are general COVID-19 questions about orders, as well as rumor control. So you'll see the hotline number here. The next one here, this is for the newly created, the Community Cares line. So again, what this is click on the link here, just give you a little bit more information. So this is a line that was specifically created to help individuals deal with the social distancing. So it's to help create connections and friendly conversations. This is where callers will find a listening ear to basically help them feel connected to others when they might be either home isolated, maybe they live by themselves and not being able to get out other than for essential items. This is a call line that is, as you can see here, a community collaboration. There's a lot of community partners working together to make this happen. We've got community volunteers that will be answering those calls Monday through Friday from 9 to 5. So, and then the last piece that I wanted to bring to the attention again is, so these mental health crisis lines. So again, that Community Cares line is not designated and not intended to be a crisis line. There is a prompt that if it is for a crisis, they will to call these two numbers that you see listed here. But the mental health crisis lines here in our community, as you can see, the one for Vallejo, so for individuals 18 and over, you'll see that number listed right here. And then for the Family Service and Guidance Center, so individuals who are 17 and under. So that number, again, is created here. We wanted to make sure that that these numbers and these resources were as easily accessible as possible. And big note here, these numbers here, these are available 24/7. So those numbers can be called by anybody that fits whichever one of those criteria 24/7. So with that, that is all the updates on our end today. So I will stop this share and turn it back over to Molly.
Thanks, Craig. Next, we'll have Dusty Nichols with an update from Emergency Management.
Good afternoon. I'm Dusty Nichols from Emergency Management, Incident Commander for COVID Response in Shawnee County. Just had a few things to go over. I'm also going to share a screen real quick. What you're seeing on the screen is the resources delivered as far as the organizations we've delivered to. This is just an addition to the screen that I showed last week. Highlighted some new facilities that we've delivered to. And these are the numbers that we've also delivered to, So you see some of the numbers go up as well. But a lot of these things are still being requested, and we still have some of the S&S supplies that are in our warehouse, and we are still attempting to reach out and gather other supplies, working through the state and some other contractors. And then another thing I wanted to bring your attention to is some of the gap training we've identified, especially with N95 masks. The mask fit testing for the N95s need to be done before we know those sizes of the mask and they can be worn properly. So our COVID-19 response team safety officer, Richard Siegel, ESF 8 planner, Esther Lamone, and health department coordinator, Missy Middendorf, have gotten together and contacted each one of those facilities, whether they're nursing homes, rescue mission, other healthcare facilities that need those masks, and making sure the mask fit tests are being done and those masks will be worn properly. We are getting some assistance from the 190th Air Refueling Wing in some of that mask testing. So if you do see Guard personnel at those locations, it is not martial law. It is assistance that we've asked for, and they are providing that assistance with our safety officers. So in this next week, they'll be conducting that training on the proper wear and masks and protection. So also, I just wanted to go over volunteers from the from the Rumor Control Task Force and the information line are reaching out to all of the retail stores, starting with the grocery stores and big box stores and other kind of retail stores, and making sure that they received Dr. Pizzino's recommendations that he put out last week for retail stores that discusses social distancing and protection measures. What we're doing that for is to make sure, first off, they've got it. We have found that not all those locations received it or went out and got it. So we're making sure they get a copy of that, and then find out what their limiting factors and shortfalls, anything they need assistance with. We're there to provide guidance and assistance if we can, wherever possible. The last thing I just want to mention, yesterday the Recovery Task Force was announced, and I got to take the hit on this one. It was I did not read it quickly. I read it quickly, and I did not catch that Commissioner Rippon was not listed on that, but he did talk at the conference and was identified at the conference. So the documentation that went out, and Capital Journal put out a story on it. It did not include Commissioner Rippon. He is absolutely part of that task force. There's some clarification of other members coming out in the next couple of days. I know we talked to Michelle Stubblefield today, and so they'll be putting out some clarification of who's on that team. And they're going to be recruiting others to be on that team as well. This is not a singular focus team. We're trying to gather people from all different parts of the community to make sure that recovery team is well-rounded and takes in as much information as possible to find that path forward. It was also identified that Aaron Mahan and I were part of the co-chairs, along with Dr. Pizzino and Linda Oakes. That was the initial framework building that plan. We are actually going to be subject matter experts and guides with information for that team, so they have some kind of other information that's outside of their typical scope to help them make decisions. So while we are not straight part of the task force, we will be providing guidance for that. And again, more of that will be coming out soon. And that's all I have. Thank you, Molly.
Thanks, Dusty. Next, we'll have an update from Dr. Pizzino.
Good afternoon, everyone. Let's start with some numbers. As usual, you heard from Craig, we have 90 confirmed cases right now. But I want to go over some numbers sort of under the hood beyond just the number of cases. The first thing I want to mention is that we had 8 positive lab results between yesterday and today. And 6 out of the 8 were individuals that were already on quarantine because they were known contacts to a case previously diagnosed. I want to emphasize that. So 6 out of 8 were already under public health monitoring. And I want to stress that this is really public health at its best. That's what we do right. That's what we need to do more and more. Without that intervention, these would be 6 more individuals walking around for 7 to 10, 14 days, infecting other people in the community, infecting other people in their families. So this is what public health does. And I want everybody to remember that. The reason some of these numbers are starting to go down is because of this incredible work that our public health staff are doing, calling each and every one of these 90 cases, and for each of them, calling each and every one of the contacts that these people list, and making sure that they know what to do if they have symptoms, that they stay at home for 14 days. You can imagine how time-consuming that becomes. A few more numbers. We have at least 14 cases among healthcare workers with one death, unfortunately. And Greg mentioned to you that we're going to start sharing some demographics information on the people who are infected. And of the 90 people that are confirmed, about 32% are African-American people in Shawnee County. And you all know that African-Americans represent about 10% of the population in Shawnee County. So clearly a disproportionate amount of African-Americans are represented in people infected with coronavirus. It's not unique to Shawnee County. It's something that we have seen throughout the country and the state. There is a variety of reasons for that this is probably not the right time to discuss. But once again, our disadvantaged population is the one that suffers the most. Sometimes people say, you know, viruses, infectious disease are, they don't discriminate. They are, you know, non-discriminated entities. And I don't think that's true. I don't think they are a kind of equal opportunity entities. I think actually many of us have stronger tools to prevent infections, and should we get infected, to overcome that, starting from the ability to work like me in my comfortable office at home, to you know, the ability to have prompt access to healthcare and everything else. So just a reminder that we are not all suffering the same way, and there are groups in our community who are suffering more. The big question, of course, what's ahead? What are we going to do next? So let me guide you a little bit about what's ahead. First, by telling you what kind of numbers and indicators in general, mostly are numbers, we are monitoring. And then I will guide you to some of the steps that we can expect in the next couple of weeks. We are not just monitoring the number of cases. That's important, of course, but it's not the only, and perhaps not even the most important element. Things that we are monitoring are the number of tests that we are doing. And that number is actually pretty high compared to the rest of the state. Our testing policy now has been expanded to include everybody with cough and fever. So it's broader than the testing criteria that the state laboratory has. And yet we don't really see, we haven't seen, since that expansion has taken place about a week ago, we haven't seen a huge spike in the number of tests, despite the fact that we have talked to our providers in the community multiple times, and they're telling us that they, you know, they heard us and they're doing that. I suspect one of the reasons may be that we really don't have a lot of people that are sick. So if we want to test everybody with cough and fever, but there aren't a lot of people with cough and fever to begin with, then we are not going to see a lot of tests being done. The proportion of tests that are done that turns out to be positive is actually pretty low and is decreasing. And that's a good thing, because again, it means we are really casting a broad net to catch just about anyone who could possibly be positive and infected. Ideally, of course, that's never a perfect process. And in the process, we also catch many who are not. And that's exactly at the point where we should be right now. The interval between the date of onset and the date that a specimen, a laboratory specimen, is collected is low, and it's going down. In some cases, even 1 day or less. That's an extremely important measure, because at the time that we collect the specimen, that's when we put a sick individual in isolation. And that's when that individual is no longer able to spread the virus in the community. So we don't want a long interval between the time that they get sick and the time that they get a specimen collected on them. We want as short an interval as possible. And we are just about as short as we could be. It's 1 day or less right now on average. We get our lab tests, our lab results, again, on average in about 2 days, sometimes even less, from the date of collection, which is a huge improvement compared to where we were a few weeks ago. And the proportion of positive tests that come from people with an unknown source of infection is low and is decreasing. So in other words, everybody who has a positive test, not everybody, the vast majority of people who have a positive test, we know why they got infected. It's either because they were a close contact with a previously known case, or because they have traveled in places that where they probably got infected. So overall, as I said, we are not just monitoring our number of cases and our growth, which is also going relatively well. I mean, our growth rate is pretty low compared to other places in the state, but we need to look at the big picture here. So our epidemiologist compiles this data every evening, and I spend a good deal of time every evening, every night, going over this information and looking at trends, because that's really what's going to guide us in making decisions about the next steps, is the preponderance of the evidence that we can collect that can tell us in which direction we are pointing. Are we still having a lot of scattered cases in the community that we can't really bring in? Or are we starting to bring the virus into a box so that we can get out of our boxes then and go back to something that resembles our normal lives more than it is now? So what are those next steps then that we will decide based in large part on this evidence that we are collecting? We are starting to develop, in conjunction with some key partners in the community, including business community, the city, of course, the school districts and others. We are starting to develop a stepwise approach to relaxing some of the mitigation measures that are currently in place. The first thing that we are going to do, we are going to develop some general principles that we will follow in deciding what activities can be considered safe and what activities are still not safe for a certain timing of our outbreak. Those are general principles. Then, and that will happen in the next few days. So I hope that I will be able to discuss those general principles at our press conference 1 week from today. Then we will spend the next few days, several days, just going through individual events and situations and trying to apply those principles to those individual events and situations and try to see how can each of those events be carried out following those general guidelines. And based on that assessment, we will make individual decisions of things that may be allowed to continue and happen, and things for which we may have to wait a little bit longer. As you know, there is a state order that requires everybody to stay home until May the 3rd. So really not much can happen before May the 3rd because we have the state order, and probably not much should happen because it's still too early. And I want to warn you, I decided to share these somewhat positive numbers with you, but also with some concern that they could be misinterpreted. It could lead to people to lower their guard and thinking, oh, we are done. You know, we don't need to stay home anymore. We can just go out and hang out with our friends. We are not at that point yet. Those numbers can turn around in a matter of hours or a few days. So it's important that we keep monitoring those numbers the next few weeks. So nothing is going to change between now and May the 3rd, which is when the state order is going to expire. After that, we will start looking at our stepwise approach. The first thing that will be lifted is the Safer at Home ordinance. It's the one that's having the highest burden on our community. That's the one that requires people to stay home from work. That's the one that required businesses to close. We are painfully aware how hard this is on our community and how many people have lost their job, hopefully temporarily, many of them, most of them, but some may also be for a longer period of time. So we will not keep that order in place one day longer than necessary. Again, nothing can change until May the 3rd because that is the state order. But my hope is that right now it's just a hope. My hope is that if our current trends continue, we may be able to not extend our local order, which, as you probably remember, preceded the state order, right? We had the Safer at Home order before the state issued theirs. We may not need to extend our local order after the state order is lifted. Again, please understand that this can all change. And I want to give people some hope. There is an end that's in view right now. That's right there. It's just a couple of weeks. Hopefully, if we all do our work and if all these numbers continue to go in the same direction. So that's the first thing that will go. Then you will see roughly every 14 days, additional measures being lifted. The reason for the 14 days is that that is the maximum incubation period of the virus. And so it's important that we do two things. First of all, that we do things gradually so that if something goes wrong, it doesn't go dramatically wrong because we are doing just one thing at a time. And second, if something goes wrong, we know what went wrong. If we lift 3 or 4 different measures all at once, and then when I say something goes wrong, what I mean is, you know, within 10 days, we have 50 new cases. We know that one of those things that we removed, probably we should not have removed, but we wouldn't know which one because we removed 5 of them all at once. So we will take a stepwise approach so that we can monitor the effect of each individual measure once it's removed from our restrictions. Things that are obviously going to be on the table are all the restrictions that we are all experiencing now, you know, being able to go to a restaurant and dine in and not just doing carry out, being able to have gatherings of greater than 10 people, being able to go to church, being able to have weddings and funeral with fewer restrictions than we have now. Some restrictions may be lifted gradually and not on an all or nothing basis. For example, the limit to the gathering size, we may decide to still have a limit in place, but larger than the current limit. And then 2 weeks later, maybe even larger than the first time that we lift that. But that's the direction where we will go. We will all move towards the direction of fewer and fewer restrictions. Events that we will have to discuss are all the typical things that we all do in the summer. Summer camps, swimming pools, concerts, fireworks show, parades, all the summer social amenities that we all enjoy. I sincerely hope that for some of them we will find solutions that can allow them to be conducted within that framework of safety that we are going to develop next week, those general guidelines. But I want to be honest, I am pretty sure there will be a few that may not be able to take place. And I will be particularly careful with large gatherings. When I say large, I mean thousands of people. And in some cases, even hundreds of people, depending who those people are, how long they spend together, and in which environment. As you can imagine, when we have thousands of people or tens of thousands of people coming in for an event from multiple parts of the state, actually, most probably even from outside the state, from communities where we really don't know, we have no control over what kind of mitigation activities they have conducted. And these people maybe are going to spend, an extended period of time, maybe multiple days on an event, being in very close contact. That kind of situation will worry me considerably, more than, a small event, maybe with 100 or 200 people outdoors where they spend just half an hour together and then they go back to their business or they go back home. So that's a kind of assessment we will do. But as I said, before we do that, we are going to develop these general guidelines. So it will be pretty clear to everybody and pretty transparent how those decisions are made, and the fact that we are not really going to make any favoritism to anybody. We are just going to take our guidelines into account. We are going to ask the organizers, tell us how you think you can conduct your event following these guidelines that we think will keep everybody reasonably safe. And then we will hear their answer and we'll make decisions with them. So final thing I want to say is, I hear that sometimes we are all at the mercy of this virus, and the way that the virus behaves is going to affect what we cannot do. There is some truth there, but I would make the argument that viruses really don't behave. Viruses are pretty predictable. Viruses take all the opportunities that they have to move from one person to the next. And for that to happen, there has to be a contact between one person who is infected with the virus and one that is not. So the behaviors that we need to watch are not the behaviors of the virus. They're the behaviors of our own community, our own behaviors. I think if people continue to follow the social distancing, if people continue to stick to our recommendations in the next couple of weeks, we will probably see extremely positive results. We are already seeing those results. We know the social distancing works. There is plenty of evidence now published in the literature for those who are interested in that evidence. And frankly, we know it works in Shawnee County. We were extremely aggressive at the beginning, instituting those measures, and we have experienced level of disease that is less than other comparable sites in the rest of the country. So we know that that works. The question is, are we going to stick with that long enough so that the virus will be able to be contained into its own box and we can come out of our homes and our boxes? So really, fellow Topekans, it's up to us to decide which direction we are going. I think I'm going to stop for now, and then we'll take any questions when the time is.
Thank you, Dr. Pizzino. Up next, we have Mayor De La Isla.
Thank you so much, everybody. I want to make sure that, first of all, I say thank you to everybody that has been absolutely phenomenal at ensuring that you are staying at home. We want to acknowledge the fact that this situation is not an easy situation, and it has come to a significant cost to all of us. We have individuals that are staying at home, that are business owners, small business owners, that are significantly struggling every single day, trying to figure out how not only are they going to take care of themselves, but also take care of our own neighbors who are their employees, our families that are struggling with this. We also are hearing from businesses, we're hearing from everyday citizens, and I get a distinct pleasure of listening to our clergy, who is also talking with me about the impact that we're seeing in our community. We have heard, this week I made an announcement that we heard that there is a significant increase in the numbers of domestic violence. And that is one of the things that we expect to see when you have individuals at home. And sometimes even that violence transcends into not only partner to partner, but it also goes into our children. We have been extremely transparent with providing to our community resources and individuals that are able to be here and help. Craig Barnes earlier talked about our Shawnee County Community Cares line. That is a wonderful resource for us to call and make sure that we are taking care of each other. I do also want to address one very important thing. Very often, there is a condition that all of us are very familiar with, and it's strep throat. And when strep throat is not taken care of in a timely fashion, what ends up happening is that strep throat can become rheumatic fever, and eventually it affects your heart. Something simple like strep throat can affect your heart. However, because it's so easily treated with an antibiotic, which is amoxicillin, we often take these small issues for granted, right? Until we see a significant issue. And I bring that small medical example up to say that one of the biggest challenges that sometimes we start seeing in our communities is the fact that because our community was so willing to act early on this virus, as you saw in the chart that Craig Barnes produced, that shows up now in your Shawnee County Health Department website, you start seeing that rather than the city of Topeka and Shawnee County having an increase that is extremely marked, what we started to see in our community, because we acted so early, was more of a curve that has started little by little going up, and we're starting to see it flatten. And that is in great part to all of your work. So I want to take some time to say thank you to all of you. But what I don't want for it to go past us is the understanding that this is still a serious and deadly virus, and that, make no mistake, we will come out from this, and we will continue collaborating to work on a recovery. But in order for us to recover, we're going to do it taking into consideration, first and foremost, life safety. We have been very blessed and fortunate in this community, and we want to make sure that as we start talking about the exciting prospect of in the next few weeks, starting to do some more things in our economy, that we are also doing it with the full consideration that this is a serious virus, that we did act as a team early on to not have a significant outbreak in our community, have this pandemic take over the lives of a lot of people in the city, in this county. However, there is work to be done, and we will ensure that as we continue recovering and bringing people back, that we still are being careful, because this is, make no mistake, a serious virus, and we have been spared because all of you have collaborated with us. So with that message, I will transition into the Spanish portion to give a little bit of a recap to what everybody has said. En el condado de Shawnee tenemos 90 casos que han sido activos, 42 personas se han recuperado, 43 personas son casos activos y hemos tenido 5 muertes en nuestra comunidad. El Departamento de Salud de Shawnee County ha hecho unos cambios a su página web, y esos cambios incluyen unas gráficas de la demográfica de cuánta gente ha estado enferma y cómo han cambiado los casos a través del tiempo. Estamos también añadiendo que tenemos una línea que, si usted va a la página de Shawnee County, no solamente se puede encontrar con recursos que lo ayudarían con su salud mental, no solamente para usted, sino que para sus hijos y para las personas que tienen algunos casos de violencia doméstica en su hogar. También tienen recursos en esa página que están disponibles para usted en cualquier momento del día. El doctor Persino estuvo hablando también un poco sobre el traer otra vez a personas al trabajo y empezar con la recuperación económica en nuestra comunidad. Estamos dejándoles saber que hace 2 semanas empezamos a hablar como equipo sobre la recuperación económica de nuestra comunidad, y hicimos un anuncio ayer dejándoles saber a la comunidad que tenemos un equipo que se va a especializar solamente en negocios también, y que vamos a empezar a hablar a cómo se va a ver el reintegro de los individuos a sus trabajos, o cómo se va a ver el crecimiento de personas pudiendo ir a presentarse a un restaurante o cosas así. Este proceso no lo vamos a correr nosotros, tenemos unos líderes en el sector empresarial que nos están ayudando a determinar cómo vamos a empezar poco a poco, abriendo las puertas de nuestra economía. Lo que es importante saber es que cada paso que hagamos va a tomar 14 días en que nosotros hagamos una evaluación, porque recuerden que toma 14 días para que nosotros sepamos si este virus realmente está resurgiendo en nuestra comunidad. Así que paso a paso vamos a trabajar con esto. El doctor Pesino también dejó saber que hay una gran población de familias afroamericanas que fueron afectadas por este virus, inclusive en nuestra comunidad, que habla un poco mucho sobre la diferencia en el acceso al cuidado médico en diferentes comunidades que tal vez no tengan recursos para cuidado preventivo. Así que es muy importante que hablemos con nuestras familias y que le dejemos saber a personas para que podamos evitar este virus, porque es muy importante reconocer que familias con mayor grado de pobreza o familias con diferencias étnicas están siendo afectadas disproporcionalmente. Estamos también, el señor Nichols habló un poco sobre los cambios a nuestro equipo de recuperación para la economía. Tenemos un equipo que ya ha estado formado, pero estamos también expandiendo ese equipo que va a incluir muchísimas otras cosas. La señora Michelle Stubblefield va a ser la persona que va a ser la líder de buscar a las personas que van a llevar a cabo este liderazgo. Y ahora lo que les queremos enfatizar es que recuerden que mientras estemos en el proceso de recuperación, cada paso que tomemos va a ser un paso que vamos a tomar, esperar 14 días para ver cómo están las cosas y luego vamos a seguir progresando. Esperamos que esto sea información que les dé un poco de esperanza, ya que estamos diciéndoles que estamos considerando la reapertura de nuestra economía poco a poco, para que podamos empezar a vivir un poco más normal nuevamente. Cualquier pregunta que tenga, por favor, déjenosla saber y estaremos más pendientes con ustedes. Muchísimas gracias.
Thank you, Mayor. We'll now open it up for questions. And as usual, raise your hand through the app and I'll call on you. And when I do, make sure that you state who you're addressing your question to, and then you can state your question. First up, we'll have Sean Wheat, followed by Dan Garrett.
Really quick, I need Dr. Pizzino, excuse me. Dr. Pizzino, can you go ahead and clarify? You said that 14 healthcare workers are ill in Shawnee County, and there's been one healthcare worker who has died. Can you just elaborate on that a little bit?
There isn't much else I can tell you about it. Yes, overall, since the beginning of the pandemic, we have had at least 14 cases that we have identified among healthcare workers. So 14 victims of the virus were healthcare workers. Could be more because that information is not always complete. And we know of one death that was among a healthcare worker. This is non-new information, by the way. I mean, the 14 cases, yes. The death is not something that happened since the last call. It's something that I had already announced before. And obviously for privacy reasons, I cannot discuss any more details about where those workers worked and who they were.
Very good. Sorry, that was my follow-up part. Thank you.
Mm-hmm.
Okay, Dr. Pizzino, when you come up with these principles that you're going to present on Friday, are you going to collaborate with the business leaders as part of the COVID recovery effort before you come up with these guidelines?
Oh, yes, absolutely. Absolutely. In fact, we will have some internal drafts probably as early as, Tuesday or Wednesday next week. And we will take the following 2 or 3 days to just vet those drafts with our partners, the Greater Topeka Partnership and all our partners. And then we would be ready to make them public. And again, that's not going to be like written in stone. I mean, those are obviously our guiding principles, the best that we can make them, and using information we have at the time we develop them, but we are always open to suggestions. If there are some changes that we need to make, even in the course of the recovery stage and the reopening stage, we're more than open. We'll be very open to listening to those suggestions.
All right, next we have Sean Wheat, followed by Dan Garrett again.
All right, Dr. Pizzino, you had talked about large events, and you said you're going to be talking about this in about a week. But one of the larger events coming to Shawnee County is going to be the Heartland Stampede, which is set for June, with thousands of people who generally attend that event. Is that one of the events you're going to be looking at closely, or is June going to be further enough down the line you think we're going to be okay?
Well, I will tell you things from my perspective, and I don't know if Dusty has anything else to add. I know that Dusty has been in communication with the organizers. First of all, let me clarify. Next week, I'm not going to make any announcement about specific events. I'm just going to make an announcement on the general principles and guidelines we're going to follow to then look at individual events. Having said that, June is really around the corner, and yes, you heard me. I mean, I am particularly concerned about large events that bring thousands of people from different communities together for an extended period of time. So, you can draw your conclusions. Obviously, we will look at the Stampede event as one of those, and we will apply our safety guidelines to that event and then come to a determination whether it can be held in a safe way or not.
Okay, Dr. Pizzino, would you be able to kind of explain a little bit about what a peak is? That's the term that everyone's been concerned about when we're going to hit our peak. So kind of explain the definition of that, and then also what is going to happen in the weeks following and what would cause it to stop the spread.
So in a typical scenario, especially when you have many cases, so I'm thinking about Italy, I'm thinking about New York, or places like that. What you see is, if you chart the number of cases, the cumulative number of cases, so the total, every day you add the new cases to those that were already there. If you put them on a chart, you will see that they start at a relatively low level. Of course, you start from 0 at the beginning, and then the curve goes up. But then the speed at which the curve goes up, which is indicated by the slope of the curve, increases day by day. And you get a point that people call exponential growth, which means that you don't just get the same number of cases, more or less, new cases every day. You get a doubling of the cases every 3 or 4 days, sometimes even 2 or 3 days. That's the exponential part. So what that means is that if a day 1, let's say you had 2 cases, then at day 3, you may have 4 cases, a double. And then at day 5, you may have 8 cases, which is a double. And then from 8, you go to 16 and so on. So when you look at the curve, you see that that curve becomes more and more steep for similar periods of time, right? That's the typical exponential growth. The peak is the point at which that growth stops and starts leveling off. And then, so in other words, the steep curve that you see, it's less steep and then less steep and then less steep. And finally, when you have no more growth, the curve will remain flat because you have no additional cases. Now, that doesn't work so well when you have fewer cases like in Shawnee County. Because you really need, when you have few cases, that you have sometimes just random variation in the numbers, and it may be just due to testing patterns or 2 lab tests that were sent to a laboratory 1 day later, and so they come back together, and then they are counted as 2 positive results the same day, but in fact it doesn't really indicate anything but just a delay in lab test perhaps. So the system works much better when you have a high number of cases. As far as Shawnee County is concerned, I really can't tell you if we are even going to have a peak. Maybe our peak is already past. Maybe it's ahead of us. I don't know. I'm not terribly concerned about the peak for Shawnee County. I'm more concerned about all those numbers that I'm monitoring that I listed earlier, because those, to me, for a situation like Shawnee County, are more indicative of which direction, which trends we are experiencing here in the county.
Next, we'll have Dan Garrett, followed by Sean Wheat.
Okay, and Dr. Pizzino, I'm hoping I'm not jumping the gun on this, but you said one of the first things you hope to do is lift the safer at home order. And I know you're going to meet to figure out exactly what all that would entail. But as of right now, what kind of is going through your mind as what that would look like for lifting it? Would people be able to just leave, or would also some businesses start to be able to open that were considered non-essential?
I think the two things are going to go together. I think when we lift the order, what that means is that number one, people can leave their houses, and number two, people can go back to work. And so most business, maybe not all, but most businesses should be able to reopen. We may still require at least certain businesses to do things a little bit differently from their normal processes so that we can assure some social distance also at the workplace. But the goal is really to remove the vast majority of restrictions on business operations. And I would say probably 100% of the restrictions on people having to stay home. Now, here is the one difference though. I can already tell you that in the first stage, we will still highly recommend that people with risk factors continue to shelter in place as much as they can. And I'm talking of elderly adults, and I'm talking of people with underlying conditions. We need to take things a little bit slowly here. And we know that the virus is still out there, and we know that those are the people that if they get sick, they can get really sick and die. So we are not going to require that, but it will be a strong recommendation for people with risk factors to still stay home and be very vigilant and leave their homes just when absolutely strictly necessary.
When it comes to face masks, I know that there has been a lot of talk about face masks, the proper use of them. From what you've seen, Dr. Pizzino, are face masks being used properly?
It's a mix, as you could probably expect. I worry a little bit, not too much. I worry. There are greater worries in my days these days, but I worry a little bit that people may still misinterpret what a face mask does and does not do. The face mask does not protect the person that's wearing the mask. It protects the people around that person. That's the absolutely critical number one item to remember. The second critical item to remember about face masks, they are no substitute for social distancing. And so the things that leaves me a little bit perplexed when I go and take a walk around my neighborhood, which I try to do every evening, and I see people walking their dogs alone wearing a face mask. I mean, they're not going to hurt anybody. It doesn't bother me, but I hope they understand that what they're doing is really unnecessary because there is nobody around them, so they have no chance to infect anybody. And I hope that wearing the mask doesn't give them the false sense of security that since they have a mask, they are less likely to be infected. So maybe they can relax the social distancing a little more because that would be the mistake. And I'll be honest with you, I issued those recommendations for retailers. One of those recommendations is to really encourage the use of masks, particularly among employees. And we're going to be monitoring that in the next few days. When I issued those recommendations, I didn't see as many employees as I would like to see wearing those masks. And I hope that changes in the next few days because that's incredibly important. Employees in a retail business that are open to the public, they spend the whole shift in contact with the public and with their coworkers. And so if one of them is already infected and is contagious over a period of 8 or 10 hours, they can infect really a large number of people. So for these people, for employees to wear those masks, it is really an important element to reduce the transmission, the potential for transmission in retail businesses.
Okay, we've got a question from Matthew Galloway and then another one from Sean Wheat.
Yeah, Dr. Pizzino, do you foresee a scenario where there can be a full return to normalcy, particularly with those large mass events before a vaccine is developed?
I think there will be a lot of things that we are not allowed to do now that we will be able to do even before a vaccine is developed. And hopefully there will be the vast majority of things that affect our daily lives I am not fully convinced that we will be able to hold extremely large gatherings in a safe way before we have a vaccine. I don't know, maybe it will be possible, I don't know, but that's really the main question that I would have. I would suspect that, with good control measures and let's not forget therapeutics, so medications that are still under study that could be effective in treating the virus. I would be hopeful that most of our daily activities will go back essentially to something very similar to what we experienced before the virus. But when I think of some of the public health conventions, for example, that typically I would attend in a typical year where we have 30, 35, 40,000 people coming from multiple countries, not just from the United States, and spending 3 or 4 days together in these conventions and moving from one break room to another break room. So there is a lot of mingling. And when you are in the break room, you're really shoulder to shoulder with some other attendees. I have a hard time imagining that before a vaccine, but I wouldn't rule it out.
All right, and this is going to be a little lighthearted here, but it has some folks have been asking about salons and getting their haircut, stuff like that. As you can see, I need a haircut myself. I've been trimming it myself. But if we start looking at Dr. Pizzino, if folks like at salons or beauty parlors start wearing masks and have their gloves on, is that something you would educate those places before you open them up that they need to take certain precautions? And could that potentially be one of the businesses that you see open back up?
Yeah, Sean, as I said, I'm not ready to discuss individual businesses and decisions that affect individual business yet. What I want to do, I want to have a clear sense of what our overarching guidelines are going to be. And then clearly there will be education for all business owners and managers, and particularly those that may have a higher risk of transmission in their establishments. There will be education on how they can implement those guidelines in a safe way. So that includes hairdressers, barbers, but it includes everyone else as well. But I'm not going to I'm not ready to single out any one category yet at this point.
I guess it's my hand still up on the chat, and I appreciate the answer, Dr. Pizzino, and that's just one of the things that have been coming through. Now, what about, and mind you, we're looking far ahead, but I'm going off of questions people are posing on our Facebook Live is schools, do you think those will be back open in August? Normalcy in life, and I know you're not wanting to specifically, but a lot of people are just concerned because a lot of folks are having to teach their kids and it's stressful. So we're trying to give folks a little bit of a idea of what we can expect. A little.
Sure, and I understand that people are apprehensive because they need to make their plans. We are very well aware of that. Believe me, we just had a meeting just 2 days ago with all the school superintendents in the county, and we discussed the information similar to what I'm discussing with you here today and our plan. I think I need to ask people to be patient for another couple of weeks. I think by the time that we, by the end of April, but by May the 3rd, which is the date where the state order to stay home should be lifted unless they extend it more, I think people will have a much more clear idea about what they can do with their kids, whether summer camps will be open, whether it will open as planned right away or maybe delayed, whether swimming pools will be open, and so far and so on. So we are very well aware there is an urgency, a sense of urgency. We didn't want to make these decisions so early that then we might have to change them because the data collected from the outbreak would indicate that those decisions were not right. So we are waiting until the last minute that we can make them so we have more data. But hopefully within 2 weeks that we'll have all those answers, or at least most of them.
Okay, I'm not seeing any other questions, but we do have one from Facebook, and I think this is for Dr. Pizzino, and they want to know, do we have the testing we need right now?
We never have enough testing, unfortunately. That seems to be the prevailing theme in this pandemic. However, things are much better now than what they were a few weeks ago. And there is no significant barrier to testing in Shawnee County right now. If people need a test, they will get a test. So don't hesitate. If you have cough and fever, just go and talk to your primary care provider or go online. As Greg showed, we have this wonderful self-reporting tool, which is so easy to use. Anybody can go to the Shawnee County Health Department website and click on the option. It's very visible at the top, self-report their symptoms, and they will get a return call from our nurses. And if there is an indication for them to be tested, they will be tested. That's the situation of today. Of course, things may change, but I understand that both our hospitals are able to accommodate the volume of tests that we reasonably expect in the next few days or weeks.
All right, I don't see any other questions, so I'd like to thank you all for attending. We will have another press conference next week on Friday at 4 o'clock.
Thank you.